Anything new today that, I mean, we have a lot of input every day from the task force. I saw it yesterday. Anything new today, Marc, that you can tell us?
Well, we meet every morning at 9 o'clock, Joe, and our rhythm is to have a late morning press event to give you updates on what policies will be rolling out. But I do think that what's important is we're continuing to collect a lot of data that I think is going to, better inform decisions. And some of that's overseas. What we've continued to see as you look at the tragic situation in Italy is that of the thousands of unfortunate deaths, there's still not a victim under 30. It's similar to what we saw in South Korea, where there were no victims under 30 that were fatalities. Some of the data that we've begun to collect inside the United States, keep in mind, is we're rolling out tens of thousands of additional tests every day, that we're continuing to see an infection rate that's less than 10%. And keep in mind, those that are getting tested, Joe, are people who have symptoms. These are not widespread tests among the general population. These are people with fever, people with respiratory ailments, and the infection rate among those is less than 10%. Similarly, in South Korea, a wide sample of 250,000 tests of people with symptoms, it was less than a 4% infection rate. So that guides our decision making, because there's been a lot of, I think, wild analysis that says 30, 40, 50% of the population will get infected. That's not what we're seeing. As well, it's also showing that, again, as we've been saying from the beginning, the populations that are most impacted and most affected are the senior populations, particularly with underlying conditions.
The rollout of the additional testing that we've been looking forward to since 10 days ago or whatever it was, it's probably not monolithic. Obviously, there's still some anecdotal stories about how difficult it still is. As a rule, would you say that it was successful and that most places have figured out how to do it and it's going well now, Marc?
Well, Joe, I think that the president and the vice president bringing private sector labs here to the White House to talk about ways that they could get ramped up as soon as possible. And as well, I got to say that our FDA commissioner is doing a phenomenal job in getting those tests approved as rapidly as he did. We've had a tenfold increase in the last week, and we expect another tenfold increase in the week ahead about the availability of tests. And so at this point, the number of tests that are distributed across the country, again, tens of thousands of new tests each day, and those that want to know where to get their tests should go to their state health officials, who can direct them to the state labs or the private sector. They can
we
get
still
them.
don't know. I guess we don't have enough concrete evidence on the malaria drug that's already approved that you could do off-label theoretically. If you tomorrow were to be convinced that it works really well against coronavirus, how much do we have? How much could we get? What would be the manufacturing issues with how much of that drug we could have, Marc?
So because it's already been approved, Joe, we would have vast amounts available rapidly. In many cases, because you said it's a malaria drug, many cases those drugs are overseas currently. We're already working at getting a lot of those re-imported back into the United States to distribute as quickly as possible. But I don't want to focus so much on chloroquine. The reality is that there's multiple different therapeutics in the pipeline right now.
That's approved. That's approved, and you could do it
off-label.
That one's approved.
Correct. That is exactly right, Joe. But others that we hope to have approved by this summer. And so, again, a lot of the studies that are out there forecast, let's say, 18 months.
It's March,
well,
Marc.
They also forecast 18 months of the virus, and they don't take into impact of the therapeutics available.
Yeah. I mean, this could be yesterday with chloroquine.
Yes, it is. And so we have millions of those available here and millions more that are coming back from overseas. So there will be ample supply of chloroquine.
Okay. Andrew, I know you want in.
Hey, Marc, I just had a question. I know you're working really on the response to this pandemic more than anything else, but one of the things that happened last night was a former member of the administration, Nikki Haley, resigning from the board of Boeing over this issue of potentially bailing out that company. And I just wanted to get the reaction inside the White House to that, and whether you believe she's trying to send a signal to your peers that this shouldn't happen, or whether this is politically motivated, or really just how you think people behind you on the lawn there are thinking about this morning.
Well, I don't think there's been much conversation about Nikki's decision inside our building, but y'all have covered for 12 years the response to the TARP bailouts, and I think there's a healthy debate about whether or not, when private sector companies have bad decisions, the extent that government should be bailing them out, what the consequences are. I think this is a very different case. This is not a market failure. This is in reality a virus that the government then, in order to protect additional Americans, asked for travel bans. And so the impact on Boeing, our airline industry, is very different than previous bailouts that I think have been considered. So it's not really an apples-to-apples comparison.
Marc, did you talk to the vice president about the Senator Burr and Loeffler in the stock sales? When you saw that, did you read about that in the press or in the media? And do you have an opinion on that?
I don't, Joe. I don't know that we have enough information. There's certainly a body that oversees that within Congress about looking at those who do that themselves versus those that defer those decisions to others. And there's an ethics board there. I'm not sure it's as appropriate for us to weigh in on that. But I think we don't have enough information yet either. And I haven't yet had a chance to speak to the vice president about it.
Right. Andrew, I know you saw it. If you get briefed, I mean, everybody knew this was a problem. Was there actual inside information, would you say, at a government meeting on that, Sorkin? Does that qualify for non-public information?
Well, look, what I don't know, and Marc can speak to it better than I can, is what kind of information is being disclosed inside those meetings that is different than the information that might otherwise be disclosed to the public. And therefore, if that was the case, this would be a little bit more complicated. But I don't know. Marc, can you speak to that at all?
Yeah, I'm not familiar with any White House briefings that senators would have received that would have given inside information that would have impacted what their trading is.
Bad optics, though.
I have no belief that transpired. And as I've said, I think the best thing we can be doing is providing as much information to the American people as possible. And the more data we get, the better informed we're going to be with the policy decisions.
The governor of California, should that be in any state? I mean, New York has more cases, I think, than California. Is that the future for most places, Marc, in your view?
I don't know, Joe, because I think, again, it's important to keep in mind that we have a federalist system, and it's important to allow state and local communities to do what they think is best for their communities, and us to provide them the resources they need to make the best informed decisions. I do think, though, we do see right now today there are 3 states that have more than 50% of the cases, and there are 10 counties that have more than 50% of the cases, and we have roughly 2,500 counties in the United States. So I don't think that it necessarily will become a one-size-fits-all policy. I think that there's an abundance of caution in some of the policy decisions that have been made to protect more Americans. But as we see better information, which we're getting now in the testing and the rapidity of the spread, it's going to inform whether or not the one-size-fits-all really makes sense.
Okay, Becky wants a question, then I have one more for you, Marc. Go ahead, Becky.
Yeah.
Go ahead.
Marc, just real quickly on what you just said, the idea that more than 50% of the cases are in 10 counties, that there's 2,500 counties in the nation. Are you all considering doing things to lock down those counties in particular to try and make sure it doesn't spread beyond?
I think that the decisions that have been made thus far and the guidelines we've been given are quite aggressive in order to try to prevent additional spread. I don't see there being a federal mandate on that. I continue to see we give guidance to state and local communities to make the best decisions that they can. And we want to, the guidelines are intended so it stays and doesn't spread beyond where it currently is. And I think that we're encouraged by the way Americans have responded from the private sector, the public sector, everybody pitching in to this epidemic at the moment. But I'm not sure that I don't foresee a federal mandate on that now.
Hey, Marc, is the vice president meeting or someone on the task force meeting every day with different manufacturers to retrofit capable companies for example, for things for our medical professionals that are in short demand, masks, clothing, or even ventilators? Can we retrofit a manufacturer that makes these very sophisticated machines? I mean, ought to be able to churn out ventilators in short order. Is that possible?
Yeah, it is actually, Joe. It's a great question. I do think that Peter Navarro inside our White House has been point on working with a lot of the manufacturing companies to talk about retrofitting. We're very excited. You've seen Honeywell actually begin to already do that and to transform some of their plants to help with the production of additional ventilators. And we commend them for their participation on that. And today, the vice president has a call with roughly 500 manufacturers organized by the National Association of Manufacturers to talk about ways that they can be doing exactly that.
Right, Beck?
Hey, Mark, we had Scott Gottlieb, the former head of the FDA, on with us this morning, and he was talking about how some of the biggest problem points you have, even in testing in other areas, is finding little things, the cheapest things that cost about a penny, something like the swab, to stick it up your nose, to swab to find out if you have the test, that those are some of the hardest things to come by because they're so low margin. His idea was that maybe the federal government could pour some money into places that would manufacture those things to make it a little more profitable so that private industry would step in. Have you all thought about things like that?
I don't know that we're looking at federal government providing that. I think the reality is the demand is there for them to go ahead and produce that, and we've been having conversations about what's needed. We also, though, the Pentagon has a lot of supplies that they've provided as well in their stockpiles that we're getting out to the marketplace, too. And I'd say one other thing, Becky. We also have, I think, additional tests coming online, very encouraging. We believe in the next couple of weeks that, again, will make the testing even more simple than it is right now. So we do think that the market is actually helping to solve a lot of those challenges right now.